video will explain how to change a dressing on a PICC line and central line in a sterile fashion and how to assess it while you're doing so. The supplies you're going to need are going to be non-sterile gloves, sterile gloves that are an appropriate size for you, a CHG pad that will be used to loosen the dressing up while you're removing it, and a sterile dressing change kit. We do have specific ones for CVCs, PICC lines, and midlines, so make sure you're choosing the appropriate one. So you'll walk in, introduce yourself to the patient, clean your hands, make sure that you have a mask and the patient has a mask if they're unable to turn their head away. So the first thing you can ask the patient is if they can move their head and look away from the duration, or look away from the dressing during the dressing change. You'll apply your non-sterile gloves. You'll make sure you have your mask on. You will open up your CHG swab, break that to start cleaning the skin and actually removing the dressing. This will break the adhesive apart as you pull. So pulling down towards the insertion site of the dressing to ensure you're not pulling it out as you're taking it off. You'll start to loosen and pull that off. So loosen the corner and then start to scrub as you go down through. The biggest thing with our dressings is going to be the presence of overlapping areas here at the end. So when you start, peel these off and then peel this piece that we refer to as the pants back behind the dressing to expose the largest part of the tegaderm, and then start loosening from there. So, scrub in a circular motion to loosen that dressing as you go down. Sometimes this will happen, you'll see the actual stat lock itself get tied into the tegaderm, but you're going to try and leave that in place until you have everything off, just to hold that dressing and make sure it's not going to get pulled as you're doing the change. From here, when this is open, you're going to want to do your assessment on the actual line itself and the insertion site. The things you're going to look at are going to be the redness of the skin, if there's any irritation, bleeding, leakage at the site. You're going to want to check the external marking. So as you can see on here, we will have what we call the hub of the line itself, which is this winged area with the dark purple end. Where it meets the line is going to be the start of the catheter, which will have a 0 centimeter mark, and then black dots every centimeter thereon until we hit every 5 centimeters, which will be numerically labeled. And that will tell you where the actual external marking is on the line itself, so you can refer to the previously placed site so you know if it's migrated at all. From here, once this is open, you will get rid of your non-sterile gloves, perform hand hygiene again, and that's when you're ready your actual sterile dressing change kit. So you'll peel this open, bring it out, and then open up your dressing change kit in a sterile fashion. Once this is open, you will go ahead and apply your sterile gloves. You want to make sure you have all your supplies. The things you're going to need are going to be your stat locks to replace the old one. You're going to want some form of protective barrier or skin prep to go underneath the dressing. In our new kits, we will have an actual CHG impregnated dressing, which will replace the previously used biopatch. So you'll see in the center of the dressing, you will have this slightly yellow area that will have a gelatinous feel to it, and this is what will cover the actual insertion site of the line itself. So from here, the first step you're going to do is move to actually clean and remove that previous stat lock. So you'll break, and then where it inserts into the skin in a circular motion, you'll start cleaning from there. And when you're cleaning this, you're going to do a 30-second scrub with the chlorhexidine, and you're going to use multi-directional scrubs, so circular motions, side to side, ups and downs. And then you will loosen the stat lock as you go through. Now once the stat lock comes off, you're going to want to ensure that you use something to hold the line in place so it's not going to migrate during your dressing change. This will then lift out of here, peel off the skin. And then you'll ensure to make sure the patient's holding still. You will, after the chlorhexidine has had 30 seconds to dry, you will get your skin prep, prepare the area. By wiping around the entire border of the line itself, and get underneath the back. And once that skin prep has dried, it no longer looks wet on the skin, you no longer have a tackiness on your gloves, you can move forward with the placement of the stat lock. So for these, the arrows are always going to point down towards the insertion site. Once you fit the actual holes in the wings into the holders in the stat lock, you'll close these doors to hold everything in place. And you will peel in an outward fashion to re-adhere that to the skin. And at this point, you'd want to recheck the insertion site into the skin to ensure that you were at the previously located spot on the PICC line. So you'll check the measurement markings, and you'll get your tegaderm back into place. Slit will always go back towards the actual end of the catheter itself. With these new tegaderms, with the actual CHG gel inside of them, this will sit center on the actual insertion site in the skin. You'll press that down without pulling on the dressing from either side. Spread that around. And as you remove the barrier, make sure that you push all the way around the dressing to get it to adhere to the skin better. So, a good way to think about the sequence of applying these dressings is going to be the same way you dress yourself. So the large dressing will be considered the shirt of the dressing. This can be considered the pants. It will go underneath the line and overlap the top of the dressing to help hold that in place and provide a little bit more securement. And the last piece that you can date, sign, and initial will be placed over top of this as the belt to occlude that final opening and provide a lot more securement on the connection pieces. And then from here, you can utilize the last foam strip that comes with the stat lock itself to ensure that the tip of the line is held in an appropriate direction, away from any points of flexion. And that completes the dressing change.